Good afternoon. It's been 1 week since we first instituted the mask requirement for indoor spaces open to the public and for organized outdoor activities of 50 or more people. By and large, I have been encouraged by the large majority of Montanans who understand how critical masking up is to fighting this virus and who've been leading by example with following the mask requirement. Yes, we've seen a few instances here and there of individuals who do not want to comply or who may disagree, but the reality is Montanans as a whole know that we're in this together. We care about respecting the individuals who are working hard to protect the health of our communities. Whether that individual is a frontline employee reminding folks to please wear a mask within their business, to those local health officers who are reviewing the best available data and putting forth policies to decrease the spread of COVID-19 within our communities. I'm incredibly grateful to so many across our state who are serving to protect the health of Montana and Montanans and taking seriously our responsibility to wear a mask. As we continue to see a significant amount of new cases each day in Montana, we continue to see that large gatherings where folks are not taking proper precautions are leading to new cases. For example, a cluster involving a collegiate sports team and their friends in Montana included 20 cases and 80 contacts in one county alone. The cluster was then later connected to additional cases in 3 other counties by way of a wedding and other social events that people attended while infectious. The majority of cases were in younger individuals. As another example, a wedding in Montana was attended by individuals who later tested positive for COVID-19 and were infectious during that wedding. This sparked new cases in the community. These new cases attended to other social events while they were infectious. At one of the new subsequent events, 3 new cases were identified. However, in a separate event, where good social distancing was practiced, no new cases were identified. We're also seeing a number of cases from individuals who either went to work while sick or didn't follow the quarantine or isolation instructions from local public health officials. In more than one situation, this resulted in cases being brought into congregate settings with at-risk individuals. As much as we all want to be with family and friends, to socialize, or to celebrate life events, these decisions can have long-reaching impacts and effects. We all need to work together and find ways to gather safely, to follow public health guidelines, and protect each other from COVID-19. We can reduce the spread of this virus with making normal habits of basic steps, like staying home when sick, social distancing, practicing good hygiene, and masking up, whether indoors or even in an outdoor gathering. We've also continued to focus on the state's economic recovery. Through the Coronavirus Relief Fund, we've been able to provide immediate relief to Montanans who need it most, and also think about ways to sustain businesses and organizations over the long term to ensure that our communities remain vibrant and provide the services that folks across our state rely upon. In the 3 months since we've had access to the $1.25 billion Coronavirus Relief Fund, we've allocated over $800 million of those dollars. In addition to tracking funds awarded, the comprehensive list of dollars advocated can be found at covidrelief.mt.gov under the Resources tab. Some of these funds have been directed to grant programs we created to support businesses, individuals, and jumpstart industries across our state. Other programs address public health, food and housing security, child care, and reimbursement for local governments. We've allocated funds to support schools as they plan for this fall, for census outreach and education, and for a public awareness campaign around COVID-19 for visitors. Several other programs work to address the various challenges businesses are facing right now and over the long term, including a program to reimburse businesses as they purchase personal protective equipment to keep employees and their customers safe, including a loan deferment program to suspend payments on existing commercial loans, and funding for businesses as they shift their model to respond directly to COVID-19. Over $100 million has been paid out the door from the dozen grant programs, with dollars going to all 56 counties. For the past month, the Montana Department of Commerce has sent out as many grants each day as it does in an average year. The Business Stabilization Grant, which has been the most in-demand program, has awarded over $60 million to help over 7,000 businesses cover rent and utilities and bring employees back to work. The Department of Commerce moved quickly through thousands of applications while still maintaining strong verifications and internal controls, and is completely caught up with the deluge of applications. Nearly 900 additional business stabilization applicants have been reviewed and contacted, but haven't responded to repeated requests from the department for either additional documents or payment information. Staff has also worked diligently to identify and filter out 750 duplicate applications or applications that appear to be attempting to game the system. We continue to remain focused among all the various grant programs in ensuring that we have the controls in place and the dollars are going to folks who need the most and who've been impacted directly by this pandemic. I'm also pleased that the program to reimburse local governments is in full swing. Part of the $800 million that we've allocated to date includes up to $300 million for anticipated costs incurred by local governments related to COVID-19. At this time, federal guidance only allows local and state governments to use funds for those direct costs connected to COVID-19, and the funds cannot be used to backfill any revenue shortfalls. To comply with the current federal guidance, we've worked closely with MACO and the League of Cities and Towns to begin reimbursing local governments for their COVID-19 related expenses. First round of requests came in from local governments across the state, gotten $32 million out the door so far. We'll soon start reviewing the second round of local government expenses. In total at this time, it's planned to have 4 different rounds of reimbursement through the year. I know that Congress is starting to, or at least planning to, negotiate a new coronavirus relief package soon. I'm encouraged that they'll be considering potential revenue assistance for local and state governments. Encourage Congress to take this moment in time seriously and address many of the many challenges that states all across the country are facing. As I've said before, in just 3 months, and we've allocated about $800 million to respond to both the short and the long-term needs, economic needs of Montanans. The Coronavirus Relief Fund was intended to assist states in responding to this pandemic through December, which is still 6 months away. Eligible expenses must be incurred in this year, because we know that things have rapidly changed throughout the pandemic, and it's clear that the virus is still presenting significant challenges to our health and safety, as well as our economic stability. We have to ensure that we have the resources to weather the next 6 months. Because we've held back some money, we've retained our ability to be flexible and act quickly when new needs are identified. when it became clear that schools didn't have the resources they needed to make safe plans to reopen in the fall, and knowing that schools can't wait to see if Washington acts, we were able to quickly allocate $75 million from the Coronavirus Relief Fund to our K-12 schools. Or when it became clear that market channels for our cattle, hog, and poultry producers were struggling, we made available grants to aid Montana's small and medium-sized meat processors. While we've learned a lot about this virus and its impacts over the past few months, we certainly can't predict everything that will come our way for the rest of the year. But we can expect that businesses, individuals, and local governments could very well continue to face real challenges. We still have a long road ahead of us, and we'll continue to closely monitor needs in our communities and address them. I'm grateful to all the businesses and individuals who have worked through this transparent process with us to ensure that we're getting dollars flowing into our communities and work toward a safe economic recovery, while also making sure we'll be able to meet long-term needs. A bit on testing. As I discussed last week, last Monday we were told that Quest Diagnostics, which is the private lab we had been using to process the tests from our community surveillance or snapshot events, would no longer be able to process Montana's tests, at least for the next several weeks. That was in addition to an already unacceptable delay time in getting testing results back from Quest. And this is all a result of an increase in cases across our nation and the inability of that private lab as well as other private labs to keep up with the demand. There's no doubt that the news that we'd have to delay some upcoming community snapshot testing events took us backwards at a time when we were making significant progress in reaching our testing targets here in Montana. Over the previous 4 weeks, we performed a total of 62,500 tests, surpassing our testing target of 60,000 tests per month. Last week alone, we performed the most tests to date at 18,521 in a week. Now, those testing goals, it was goals that we set forth to achieve collectively as Montanans. And it's in the best interests of our state that we continue to increase our testing capacity to get our hands around this virus. As such, I certainly refuse to let the shortcomings from a lack of a national testing strategy stop us in our tracks. As we have throughout our response to this virus, we strive to do things the Montana way by looking out for our neighbors and putting public health first. Over the past week, my administration, and I'd really like to give a shout out to Major General Matt Quinn in that respect, has really been working aggressively to find alternative solutions to ensure that we can stand up community surveillance testing events and receive results back with an acceptable turnaround time. Today, I'm also pleased to announce that we have found a Montana solution. We'll be partnering with Montana State University right here at home in our state to do testing of surveillance, or the processing of the tests for surveillance asymptomatic samples. Our state lab's working with the university on the validation of their machines even as we speak. And we anticipate that the university's lab will be able to begin testing live samples from 500 people per day starting as early as next week. Additionally, Montana State University is developing pooling methodologies which should allow for much greater testing capacity. This pooling methodology, which is approved by the FDA, combines a handful of surveillance tests into one testing run, giving us the capability to increase our in-state testing capacity by 3 to 4 times. Our priority is ensuring that we take a measured approach to getting back to where we were before Quest stopped taking our community surveillance samples. That priority certainly includes making sure that we have an acceptable turnaround time on tests. We don't want to get back to a point where it's taking weeks for folks to receive back their test results, as have been the case with Quest as of late. We also don't want to be left high and dry again in the event a national demand for testing puts a state like ours onto the back burner. While we'll not be able to immediately open back up the type of mass community testing events we were doing in the past, we're really building on a long-term sustainable solution to doing so, and do anticipate returning to greater community testing soon. I'm confident with MSU's research enterprise and ingenuity, Montana will have much of its testing capacity done here in state at the university and through our state lab. At the same time, however, we're also finalizing a contract with a different reference lab out of North Carolina to run some of our additional testing samples. They've committed that they could run at least 1,000 tests per day, and they've already sent testing sample kits for Montana to use. Again, we're being cautious, taking a measured approach to ensure that our turnaround time with that lab is at a reasonable 2 to 3 days from time of arrival. Montana State University has been an enthusiastic partner in helping our state resolve the testing capacity shortage as a result of Quest. I'm so incredibly grateful for that partnership as we all work together for the people of Montana to find a path forward in the new challenges that have been presented to us. President Cruzado knows well that we're all in this together. Grateful for her making available the equipment and the personnel to accomplish our testing goals, but even more importantly, for steadfast leadership to the people of Montana and to the university community and the greater community during these unprecedented times. With that, I'll turn it over to President Cruzado.
Dear Governor Bullock, thank you so much for that kind introduction, and thank you, Governor, for your leadership through this very difficult time. As the state's land-grant university, this kind of service and outreach to the people of Montana is exactly what we're called to do as part of our mission, dating as far back as our founding by Congress and by President Lincoln in 1862. This is what we do. The land-grant university was created with a very specific goal in mind: to serve in the people's interest. And it is truly our honor to help the people of Montana in this time of crisis. As the governor has said, we have found a Montana solution in helping the state resolve its testing capacity shortage. Our researchers at Montana State, under the direction of our Vice President of Research, Jason Carter, will be organizing the operations of 4 qPCR devices to test up to 500 individuals a day. This is not just an issue of having the right equipment, but of having the right people. For decades, we have been building our capacity, and today, as the state's largest research institution and one of the most research-intensive universities in the region, Montana State has the necessary expertise among our students, faculty, and staff to run this project and to assist our state. Our researchers have poured their enthusiasm, their creativity, and their energies into making this a reality. Thank you so much, Major General Quinn, for making this partnership happen. And now, on behalf of Montana State University, I'm proud to present you, Mr. Governor, with a gift. It's going to be socially distanced. There's one for you as well, General Quinn. This is Montana State's Clean Cat Kit that we'll be providing. We will be giving this out to every faculty, student, and staff at the beginning of this fall semester. It contains, of course, an MSU face mask. I have noticed you needed one. A spritz bottle of surface disinfectant, a bottle of hand sanitizer, and 3 machine washable clothes to wipe down surfaces. We have assembled more than 20,000 of these kits, and I am sure you will find all these things very useful as you work to slow the spread of the virus. Once again, we're truly honored at Montana State University to have this call to duty and an opportunity to serve all Montanans. Thank you.
Thanks, Dr. Cruzado, our President Cruzado, and Doctor. So many different. And again, really appreciate Montana State University's efforts. We'll now open it up for questions. If you have a question, you can press 5*, isn't it? If I could forget that. If your question's already been answered, you could press 5* again to unraise your hand. And questions for either myself, President Cruzado, General Quinn. First question.
Hi, Governor, this is Corin Cates Carney at Montana Public Radio. Can you hear me?
Sure can, Corin.
Great. I'm wondering, is the state still in contract with Quest? Like there was a $6.1 million contract. I'm wondering, with the backlog, if there's considering of breaking that contract, and with this new contract you mentioned, what's the cost of that?
So a couple of things. The contract with Quest was always for their test processing. So it's not like we said we'd pay them a flat amount of money throughout. So it's for each individual test. And so from that perspective, there's no contract necessarily to break. They've run into, and they are the largest reference laboratory, I believe, in the country. And as you've seen spikes all around the country, that sort of the demand has exceeded what their abilities or capabilities are to process those, and certainly in a timely manner from my perspective. So there's no contract to break, and the discussions is a week ago Monday when Quest informed us that they wouldn't be able to continue to take from sort of our community snapshot testing, which said that they may have that capability in the next few weeks. So it's not like, you know, we'll continue to keep in conversation with them, but what really pleased that I think we found some workarounds. And I'd note both Montana State University and the North Carolina lab was found in part as General Quinn spoke to his counterpart in another state to say, what are they using for overflow? Next phone question.
Hi, Governor. It's Matt Bowles from Kaiser Health News. How are you today? I have a question kind of related to Corin's. What you're announcing today gives the state additional capacity of 1,500 tests a day. How many tests was Quest doing at its peak for the state per day, and what kind of deficit are we still facing? And relatedly, do you foresee resuming testing for the state, or are you making permanent changes here?
So I'll answer a couple different questions, and then maybe for our highs, I'll turn over to General Quinn. Yeah, so what we're looking at is continuing with a target of 60,000 with Montana State University and this North Carolina lab, and continuing with what is happening at our state lab. We think that we can meet that. Now, the discussion, and I mentioned it in the body of the comments of pooling. So, and I'll also step back that Montana State University, what we'll be using them for is the non-symptomatic cases. What we're doing with our overall sort of snapshot testing and the larger area testing. And in part that's as a result of that incredible research lab, but it's not necessarily a CLIA lab which is a certification that like our state public health lab has. As they get up and running early next week, the possibilities of pooling tests, which would be taking 4 different samples and running them all together, if what you have is no negatives through that, then no further, nothing more needs to be done with those 4 samples. But if indeed there ends up one positive or a positive marker, then you'd run each of those samples individually. But so you have the potential, even through that pooling, as we get up and running, to be doing 2,000 tests, up to 2,000 tests per day at Montana State University. Our state lab has been consistently doing 1,000 samples, typically symptomatic folks and frontline responders and contact tracing each and every day. Just those 2 solutions, MSU and our state lab, would provide the capacity up to 21,000 tests a day, and that's not even counting the North Carolina reference lab. So a long way to say that, no, look, this is all throughout, right? It was May 15th when we first started working with Quest, and it was such an important solution for us to come up with at the time. As there are supply constraints there, to have MSU on board is but one example. I think we can meet the needs that we have in Montana with these 2 solutions. But that doesn't mean that we won't be returning to Quest at some point, or, what we need to do is make sure that we have continue to plan and prepare for whatever might be thrown at us. And this is a welcome addition at Montana State University. As far as the number of tests, the maximum time that we'd sent out to Quest. Yeah. Matt, General Quinn doesn't have a specific daily number. At times typically what would happen is like if you did a larger community event, right? As we did drive-through testing at some of our tribal nations or Big Sky as an example, then you'd end up aggregating all of those and sending those larger snapshot testing to Quest. So there wasn't a specific daily number. It's what was happening with the greater community testing. Next phone question.
Hi, Governor. This is Jonathan Hettinger, Montana Free Press. I was just wondering, do we really need to be doing 60,000 tests a month? And it sounds like almost every case is coming out of the symptomatic and contact investigations. And then I had a second question, which is, what does the new testing setup mean for testing supplies? I heard some counties were told to throw out a lot of their old test kits.
So to the first question, no, I think as we turned around and said, look, you want to do, no matter what, baseline or regular testing of anybody that's symptomatic. We've gone to the point of when a local public health department does contact tracing, we're testing everybody within that had exposure to someone that is positive. We want to provide regular surveillance testing of all staff in congregate care facilities, like long-term care facilities, assisted living facilities. We want to make sure that frontline workers, be it in healthcare or other areas, have the capability to be tested. And then finally, that as we know that there's both asymptomatic, so cases without symptoms, asymptomatic positives, and the concern for transmission, the greater amount of larger community testing that we can do, I think it's better off for all of us. So to that extent, this doing 60,000 tests, which was a target we set a bit ago, a month, I think is a good target for Montana, and something that we want to continue along. And to the point of, so what about supplies, I think was the question, and then some specifics about some counties maybe having some supplies that may or may not work with specific testing platforms. I mean, one of the reasons why we've come to this solution is the reagents that are necessary. Like, we can get the reagents that are needed for the Montana State University machines. We continue to get the reagents, so that's the supplies that you need to process tests. We continue to get the supplies that we need at our state laboratory. There are other machines and frustrations in as much as that many of our hospitals and healthcare providers around could help out with testing as well, but they can't get those reagents and supplies. And we've brought that up. That was one of the conversations last Monday that had with Admiral Giroir, who's the head of testing overall at the federal level, and said for those specific machines that it still looks like it'll be a while whether that they can get testing. But to the extent that any county, when you look at their testing supplies, which are typically a swab, test tube, and the viral transport medium, that has any concerns about not having enough of those supplies, that they should reach out to our joint coordinating center and we can get them for them. Next phone question.
Hey, Governor, this is Holly. How are you doing?
I'm good, Holly. How are you?
Good. So I've got two questions for you.
All right, why don't you ask the first one, then we'll keep you on for the second.
Perfect. So I'm wondering, this might be a little duplicative, but I'm not sure that it was answered, but I'm kind of wondering about the percentage of tests the state's done maybe over July, or since we really ramped up capacity. What percentage of those tests were done on either asymptomatic people through surveillance or sentinel events? And then do we have an idea of how many of our positive cases over the last month come from that type of testing? I'm trying to gauge, as we watch case growth while we're trying to build up our testing capacity, if that might be skewed at all, just if we're seeing fewer tests, and trying to just understand how many come from people who are symptomatic versus those asymptomatic ones we're catching at the events.
Yes, so what we'll try to do, and Holly, is get you the direct data on that. I will say by and large, like the larger community testing, where we're offering testing to everyone out there, that the numbers of positives that we've gotten out of that are really, really small. Like, I think back a few weeks ago to the Crow Nation, I don't know, we probably ran 1,500 tests and got 3 or 4 positives. So as we look at that, as we sort of look at our growth in cases, first and foremost, it's not because we're doing more testing. It's because that there's more spread of the virus, and that spread that often, if we take the same steps near the end of July that we're all taking together in March and April, that will stop that transmission. But we'll try to get you the specific numbers of sort of the asymptomatics versus symptomatics. Now, when you turn around or at least the number of positives, what we'll try to get you is the number of positives that have come out of sort of the community-wide testing. When the state lab is running 1,000 tests a day and above, how they get those, it's more or less the gating criteria that we send it to the lab, but doing a daily of this is the number that had symptoms, this is the number that were contact traced, and the like would be a little bit more challenging to provide you any real tangible data that I think could be useful.
Okay. And the second question I had, sort of following on from earlier. Sorry about that. Wondering if you can tell us the name of the lab in North Carolina, and then what sort of costs are being discussed with entering into a contract with them, if there's upfront costs to getting into that contract, or if it's just on a basis of how many tests they run once we have that contract in place.
I'll turn it over to General Quinn on that for the details.
So hi, Holly, it's Major General Quinn. So the name of the company is Mako, M-A-K-O, and really nationwide the standard cost that is out there still for PCR testing is $100 a test. So we haven't seen any change on that pricing, and that's what we will be paying Mako.
Thank you.
General. Yeah, that's the same that we were paying to Quest. There's no upfronts or anything like that. It's per test processed. Next phone question.
Hi, Governor. It's Maritza Georgia with NBC Montana, and I have 2 questions for you, if that's okay.
Sure, Maritza.
Our state has added 1,800 cases in 21 days, and I know the hospital in Kalispell is filling up. I'm wondering if you're concerned about hospital capacities in places like some of these medical hubs, which serve many surrounding rural communities as well as their own.
I am concerned about that in as much as that, to your exact point, it's not just Kalispell, it's Billings. These are regional medical centers. So it's not just taking patients from their respective communities. And we're in regular contact with the hospitals and discussions about what their capacities are along the way. But look, on the one hand, I guess I'd say that anytime you see hospitalizations, it's concerning. On the other hand, we're not at a point where, as we look at sort of what the hospital capacities are, that there aren't adjustments that can be made along the way.
Thank you. My next question is Montana was added to the quarantine list for New York, New Jersey, and Connecticut, and I still hear a lot of concerns daily about the amount of out-of-state flights in Montana. I'm wondering if you've discussed at all bringing back any kind of quarantine period for our visitors.
Yeah, so first to the New York, New Jersey, and Connecticut, putting Montana on the list. I mean, we've actually been reached out to some of those states because I think the thresholds that they've been using, it seems a little bit arbitrary, so I'm not sure that Montana would be met given what both our caseload is and even the caseload of growth. To the second, that this time haven't put any restrictions on quarantining for out-of-state visitors coming to Montana. We'll continue to look at it, but we expect anybody that comes to Montana to take this as seriously as Montanans, and that certainly requires masking and social distancing. Now, as I've noted, even some of the cases that I explained today, the vast majority of cases that we are getting in Montana, the vast majority of transmission, it's Montanans. And it's Montanans not taking the steps that we know we need to be taking to protect ourselves and one another in social gatherings.
Jessica Watts with ABC Fox Montana. You mentioned earlier in your opening statement, it's been 1 week since the new mask directive, and you said a lot of people are complying with it, but there's some that aren't. So what do you have to say to those people who are challenging the constitutionality of your new mask directive?
Well, I'm not sure that, I mean, people have said things about the constitutionality of it, but as discussed last week, for 200 years, one of the core powers of state and federal government is actually protecting one another, especially in times like pandemic. And there's never been a mask requirement throughout any court that it's struck down. And that more than, though, just sort of the constitutionality, like, right, you don't have a constitutional right to get other people sick. But more than that, it's Montanans treating one another as we know that we need to actually get our hands around this virus. And for all of the times that somebody might say, oh, this seems like an infringement to me, you're all not talking about all the people that are saying, we're doing this. And you can go down Main Street of Helena or all across our state where folks are taking it seriously. And it's great that Montanans are taking it seriously. And I think even the overall national conversation is starting to change. When the president says it's patriotic to wear a mask, I hope all those folks that have concerns about masks look at it as saying it is patriotic. But it's also how we treat our neighbors and how we should be treating Montanans.
Governor Bullock, John Riley, Montana Television Network. This might be more of a question for MSU, but who is going to be heading up the team for MSU testing?
Go ahead, President.
Thank you very much. As I mentioned before, that effort has been led, it's being led by our Vice President of Research. His name is Dr. Jason Carter.
And you mentioned that researchers will be working on this. Will there be any undergraduates working on this?
Well, that is, right now, again, this happened so quickly. This invitation to serve happened so quickly. At this moment, I can tell you, all hands will be on deck. And to the degree that this can be a good educational opportunity for graduate and perhaps even undergraduate students, that's still being discussed, we will be able to make that opportunity available to them.
Thank you so much for your time.
Thank you.
Next phone question.
Good afternoon. Good afternoon, Governor. Chris Peterson, Hungry Horse News.
Hi, Chris.
On a personal note, I was one of the first people in Columbia Falls to get the surveillance testing, and I still haven't gotten my results. From a state standpoint, do you have to pay for that test? I mean, it's basically worthless.
So, Chris, I'm not sure when you were tested, and look, the frustration in some respects of like 7 to 10 days or even more from Quest is one of the things that necessitate all of this. But it also depends on the local communities, in as much as many local communities have gone out and told people when they were positive, but not necessarily reached out when they were negative. Final phone question.
Hi, this is Nikki Willett from Yellowstone Public Radio. Thanks so much, Governor, for holding this press avail. I've got 2 questions, so I'll start with the one. Is the state going to pay Montana State University for the tests run there, and at what rate will the state be paying?
Sure. So the state will be paying Montana State University the same, initially they'll be compensated at the same rate that the state established with Quest Diagnostics, so also that the university can rapidly scale. However, after the equipment, the reagents, the personnel workflow are in place, and we look at even from the first 30,000 tests, we'll certainly review. MSU only wants to cover its costs, not to be turned into profit, if that's okay.
So am I to understand that each test, the state of Montana will pay MSU $100 per test to MSU?
Correct.
Great. And then you mentioned this a bit, but I'm curious, what do you see as the most important thing Montana might see out of another relief package from Congress? You said relief to local governments. Could you expand how much you think would be appropriate, and what other priorities you have from that congressional relief bill?
Well, I think that there are a number of things, like was just on a call with all of the nation's governors earlier today. The discussion of trying to make sure, and Montana is in a much better position than so many other states, but we're not immune at the state and local level of the economic impacts of COVID-19. So I do think a part of it has to either provide new dollars to replace lost revenues or allow access to former dollars, and hope that's part of the overall discussion. I think that the discussion of making sure that dollars go to both on the healthcare side, the continued testing, and to make sure that states and local public health has what it needs in that respect. And I think there's some discussions about, so the unemployment insurance benefits are soon to expire. I think there'll be discussions about that as well. I know from even this morning's call that there is discussion about using some federal dollars when it comes to our K-12 schools. And were that the case and were it adequate for what our schools need, maybe we wouldn't have to use those State CARES Act dollars for it. And whether or not there's going to be any additional paycheck protection program and the subscription, we'll see. But first of all, I mean, I guess to even step back further, that you know, there's been at least some chatter that, well, maybe it'll take sometime mid to late August for them to make a decision. And I hope it's a lot sooner, because I think the predictability of schools opening, the predictability of what we're trying to figure out with any of the remaining dollars from CARES 1, and it's not just Montana, it's every state dealing with some of these issues along the way, that hopefully, initially they were saying they'd have it wrapped up by the end of this month, and I hope that they can find some consensus to do so.
So are you saying that you would support seeing an extension of that extra $600 to unemployment benefits?
Well, I think that what you have right now is that it's all to expire pretty soon. And the discussions and the debate is that could it be $200, could it be $400, could it be $600? No, I'd support any facet of that. So I'm not wed to a specific number. I know that in Montana too, you know, individuals who were getting the additional $600, if indeed the employer asked you to come back to work, if there was a job there, then you'd no longer be getting that unemployment insurance benefit along the way. So I do think that as part of that overall discussion, you know, the National Governors Association hasn't turned around and said, here is, nor have I, here's the specific dollar amount, but the recognition that the federal support on UI is soon to expire, and there's still some real economic challenges around our country, so that they need to figure that out in this CARES package. Well, great, and again, thank you for President Cruzado coming here, but thank you more for the good work that MSU is doing, and that was, I mean, underscored as part of it, the discussion of, in response to a question, you moved and you moved quickly. And the difference in distinctions and the importance for Montanans will certainly be reflected as we start testing next week in Bozeman. And thank all of you.